Welcome to the Center for Global Development. I'm Amanda Glassman, the Executive Vice President here. We're a not-for-profit think tank based in Washington, D.C. and London that focuses on global economic and social development, global health, among other issues. And we're really pleased today to focus on Peru, an upper middle income country, and its experience in battling the COVID-19 crisis. Why are we focusing on one country? I think there are a lot of interesting questions to explore. It's demonstrating the fragility of hard-won gains in development. It's a great spot to discuss how the international system has aided or not in the government's response to COVID. And it might also illustrate the dangers of exporting strict lockdown-style policies in a middle-income country with a very large informal economy. We looked at Senegal a couple of weeks ago, and we hope to focus on South Africa next. But for now, let's go back to Peru. If you look at Peru experienced 21 straight years of constant and sometimes extremely high economic growth and performed best of all Latin American countries in a difficult economic year in 2019. The country had dropped poverty, reduced childhood mortality and stunting, and improved nutrition. It was so much, it was named an exemplar by the Bill and Melinda Gates Foundation earlier this year. But today we're facing the 144th day of a state of emergency that's now set to expire at the end of August. And since the first COVID-19 death reported on March 19th, and despite the very restrictive lockdown, at least 29,000 people have died from the disease, with an additional 47,000 excess deaths reported, making Peru amongst the countries with the highest number of deaths per million, and with total cases per capita akin to the worst affected countries. So for now, the trajectory of the disease is high but flat, but the health system continues to struggle with oxygen shortages and capacity, and the drop in growth, prominent increase in poverty has also been especially dramatic. And again, despite ambitious policies to transfer cash through multiple existing and new programs, the Ministry of Economy and Finance reports that 86% of the population is benefiting. We'll ask our panelists if that's accurate, as well as a multi-phase effort to support firms that are affected, called Reactiva Peru. Peruvians are dissatisfied with the extent of the measures taken. Today in the national newspaper, El Comercio, 84% of people reported being unhappy with the measures taken so far. There's also been a reported increase in gender-based violence, with more than 900 girls and women reported missing since the lockdown began. And this week, another episode in an ongoing governance crisis. The presidential cabinet was changed. That happens routinely on the National Day on July 28th, but the Congress refused to endorse a new cabinet. We think that's resolving today, but the bottom multiple dimensions. And we're really lucky today to host an amazing panel that aims to give an update on where things stand and right and the role of the international community. We'll start with introductory remarks from each, and then we'll move to a conversation. We'll start with Piero Ghezzi, who's the founding partner of hacerperu.pe and a former Minister of Production of Peru. So Piero, please go ahead.
Thanks very much, Amanda. Thanks very much for the invitation. As you said, Peru has clearly underperformed in the pandemic. At the public health level, the one number you indicated, we have one of the highest, perhaps the highest, per capita death rate in the globe, with 1,400 deaths per million people. That's super high. At the economic level, the World Bank, for example, has us with the third largest contraction in the world, only better than Belize and Maldives, right? Touristic destinations that are supposed to be very bad, no? It was not supposed to happen. I mean, of course, we had our weaknesses, the super high levels of informality, as you mentioned. Peru's informal sector is like 70% of GDP. And we have probably 20 percentage points more informality that we should have based on our per capita GDP, but still it's very is high, no? Of course, also the poor quality of our public goods and services, particularly the health system, and overall limited state capabilities. No? Those are our weaknesses we knew, but we also had strengths. Peru has been the darling of financial markets, multilateral institutions in macroeconomic levels, so together with Chile, very low levels of debt to GDP ratio, high international reserves, high growth, at least for a certain period. So this combined outcome should not, I think was avoidable, should not have happened. And it has a lot to do with crisis management. I think we had poorly designed and poorly implemented policies, both in the public health and economic levels, and most importantly, very limited interest in making corrections and building capabilities over time. Let me give you an example. Of course, President Vizcarra was very on declared a very strict lockdown in early March, mid-March, without any death in Peru. That won't plod it, of course. But already by mid-April was clear that this wasn't working. If you see countries with successful lockdowns, the death start to peak 25, 30 days after, 25 days after the lockdown, and they start to come down. You saw that in Milan, in Madrid, in New York, in different successful cases. And you were not having nothing like that in Peru. The death have kept climbing for the first weeks, months, and the government didn't make any adjustments to policies. I think there are three things that I think are important to highlight in the public health level. First, they never address the issues of agglomerations. No, if anything, that things got worse. Second, they started like a stopgap measure, taking this serological test, they call test rapidos here, no, that's supposed to be used for see the trace of the disease, but not for diagnosis. And they never built up capabilities. Peru now, as of now, is testing approximately 1/5 to a sixth of what Chile is testing per capita in terms of molecular testing. So never made the effort, right? Something was supposed to be an emergency solution, that is to use this serological test, became the standard, and never they made any effort. No. In terms of the economic front, this is probably more surprising. No, the government made a huge fiscal adjustment of 12% of GDP approximately in March. And the one plaudits from everybody, in particularly the international community, but in practice was a lot less than that. I think has been very modest. And I would say there are at least three things that were problematic. First, the bonds given to poor Peruvians were very slow, very uncertain. So people did not know whether they would get the bond or not, and many people never got it, right? Second, very limited effort to relieve the most problematic affected sectors like tourism. There has never been a sectoral policy to alleviate the tourism. And also the small and micro enterprises have never been really relieved. A little bit of loans, but not really. I mean, the vast majority has not received anything. And third, no effort, almost no effort to stabilize the formal employment sector. So there was something in in March at the beginning, but since then, there has been no effort to stabilize, to preserve formal employment. As a result, we had that in the quarter to June, the employment in Lima Metropolitana, in Greater Lima, fell 55%. That's huge. No, that means that 2.7 million people in Lima, you extrapolate to Peru, it's around 10 million Peruvians losing their job. GDP in April fell 40%, in May fell 33%. So we are expecting a minus 15% contraction for this year. If this materializes, it's going to be the largest contraction since we have national accounts, the largest one single year, right? 1 year contraction, because during the Garcia years, 87, 89, 88, 90, With Alan Garcia, we had a larger construction, but spread in 3 years. Here, it will be the largest ever, with potential risk to the downside. We already are seeing an outbreak, what looks to be an outbreak. And the sad part is that we could not call it a second wave. We are still in the first wave. Peru is having a very long first wave. Government policies seem to be limited in the sense that it's very difficult to believe that we're going to go back to a generalized quarantine that never seemed to work in the first place. So maybe some targeted quarantines may be in place, but we are in a situation where the choices are not great. In terms of what to do in terms of economic policy, I think the first is that Peru has always been transparent with very strong macroeconomic indicators, figures, forecasts. The government doesn't seem to have any economic projections right now, doesn't have a plan, a strategy. Measures seem to be disorderly. So it would be great if the government put together a plan or strategy of what they're planning to do. Right now, you listen one measure, then another one, but seems to be do not seem to be part of a strategy. Second, I think you need to make a huge effort to preserve employment in the formal sector. That means payroll subsidies, both, well designed. You should, of course, target some of the most affected sectors. It should be shared between government, employees, and the state. No, but we should make an effort there. Then, of course, some sort of Keynesian spending and tax deferrals. Today, I'm paying taxes. So it was a deferral that was really from March to August. So the government should have deferred taxes, but I think that should be part of the solution. Special programs to the most affected sectors and the SMEs. Capitalization of the micro enterprise financial sector. I think Peru doesn't have a state bank that lends to the small firms, and the big banks do not do it. So that's taken by the small microfinance enterprises. They should be capitalized because they're clearly in a very difficult situation. And of course, we have to expand the list and stabilize the list of beneficiaries of the bond for the poor and the eldest. Now, I think, just to finalize, these economic recovery measures will not suffice. I think Peru, even though had maybe a little bit of a higher growth than the rest of Latin America over the last 3-4 years, we were not doing well already in February. The pandemic has made evident our weaknesses, particularly our informal sector and our weak state capabilities. And we need a restart to address those issues. But I don't think this is happening. I mean, we wrote an article saying that we need a reinicio, a restart, because we cannot just go back to February. Things were complicated before. But nothing of what the government seems to be doing is addressing that. Of course, this is complicated by the political climate. You know that we did not, as you mentioned, we had a problem with the prime minister that didn't get a vote of confidence in Congress. And even if it's too early to tell, the leading candidates in the elections for next year don't seem to be that interested either. So to wrap up, I am normally optimistic, but it's difficult to be optimistic at this point in Peru. We need to go beyond some of the economic recovery measures, and we really need to make changes that allow Peru to go back to a path of economic growth and development. That's it. Thank you.
Great. Well, that's an incredible overview, and it is so shocking to hear about 55% employment losses. It's actually difficult to comprehend, and it will take a while to sink in. So our next speaker is Camila Gianella, who's the Executive Director of the Center for Social Science Research, CICEPA, and an assistant professor on the faculty at the Pontificia Universidad Católica del Peru. PUC. Good acronym. And I think you'll talk a little bit about the social and health consequences of what's happening and what you see as what's gone right and wrong in the response. Camila?
Thank you. Yeah, well, as you say, and already Piero say, Peru took early measures, and I think why we took that measures is also, I think that the health authorities were aware of the poor health system. So it's also that we took that strict measures because we knew that we didn't have the capacity to confront this disease with the situation that we have in the health system. This is a disease that creates a lot of stress in health systems. So, and the idea was to, in order to gain time to create more flexibility in the health system, that we take these super strict measures and radical and have as Pierre already said, didn't have the expected impact that we were thinking or was expected in a way. So I think that is important to say that also when you say a country that taking such an early measure without deaths, because by the mid-March we didn't have any deaths, was because I think in some point that also shows the weakness of the health system. And that is something to take into account. Because I think that one thing that Peru, and in the case of Peru, has to bring on the discussion at the international level is how we are assessing development. So Peru is supposed to be in a good place. We were in the way to universal healthcare, and what that really means, and in a country as Peru, how we are assessing what are these goals, and how we are assessing this is something that we need to think about. The other issue is that it is problematic to take a picture of the country thinking that we have a national level outbreak when the disease is moving to the different regions. And I think that one of the things that have shown the disease and the outbreak is that the lack of the capacity of the state and the regional governments to plan in advance, even though the disease has provided some time to plan in advance. So if in May we have the hotspot Lima, in the north Chiclayo and Loreto, and that was the part, and we already knew because of the situation in Lima and Loreto that oxygen was an issue. The Puno, Cusco, and Arequipa had enough time to prepare for that, and they didn't. So this shows also the lack of capacity at the level of the institutions to implement and to plan, and a really, really weak capacity of the central state, of the Ministry of Health to foresee this and to try to plan and to force in advance to these regional governments to plan and to prepare. So what we are expecting is that the outbreaks are happening in different moments. So we have different crises around the country, and just when the central government arrive and take control of the thing is when it's just to control damage and situation that is already with a lot of deaths, and many of these deaths could be prevented. So I think that is also what is showing this is a weak institutional capacity at the level of the regional level, but also the level of the Minister of Health that we need to try to understand. The other thing that we need to think more and is problematic, and is that this is happening in a country where we already have a lot of social conflicts and things that could be getting worse in a situation that is an emergency situation. So for sure, we need to resume the economic activities, and we need to plan that, but this with a government that has, as I said, a lot of capacity to plan and to plan in advance. So we knew that this is an infection disease, and we know that markets and overcrowded places, that will be problematic. And only when we have this huge situation with the markets in Lima, that we make some epidemiological studies in some markets, say, okay, markets are a problem. Yeah, we knew that will be happening. Public transport is going to be a problem. But now we have some economic activities that are starting with like with more like a construction or like buildings and even mining, and there is not any effort to try to trace the situation and to try to calm the populations that are around these economic activities to say, okay, this is not a problem. We are going to prepare this. We are making a traceability of the cases. We know what is happening. So this economic activities is not a risk for the population around. So that is not in place. So, and probably we are going to have again a confrontation, and then we are going to come just to, again, to take measures just to damage control when we can try to make that in the earlier stage. And I say, okay, we are in an emergency, but still we have some time to plan and to try to make the things in a better way. So I agree with Pierre. We are seeing this is happening in a country where the state is showing really a poor capacity to plan, and where at the different levels, at the national, at regional, and also the local levels to plan and to try to prevent the spread of the disease, but also to prevent the more damages from the disease. I will just leave it there.
Thank you, Camila. I think both of you talked a lot about this issue of state capacity. And I guess one question is, could you buy more capacity with more money? And so maybe that's a good time to turn to my colleague, Liliana Rojas Suarez, who's the director of our Latin America initiative and a senior fellow at the Center for Global Development. And if you can tell us a little bit about Peru done in terms of accessing IMF resources, what you see the trajectory and the issues coming up.
Thank you, Amanda. Well, first, let me make a couple of comments, also as a reaction to what the previous speaker have been saying. When we compare, Peru is really in a very bad situation, but I am amazed of how homogeneous Latin America has been in terms of the evolution of the COVID-19 death. By now, 7 out of the 10 worst countries in terms of death per 100,000 inhabitants are in Latin America. Peru, Chile, Brazil, Mexico, Ecuador, Bolivia, and Colombia. The others that are joining this group are the US, the UK, and Iran. And this combines countries with very tight and prolonged lockdowns like Peru, and others where the presidents basically decided for a long time to ignore the pandemic, and I included countries like Mexico and Brazil. So there's a lot of heterogeneity and a lot of bad things and mistakes done in Peru, but the outcome in terms of deaths is not that different between different countries that have implemented in Latin America that have implemented different kind of health reactions. And that seems to be that is the weaknesses in the region that have prevailed. And unfortunately for us, Peru is outstanding in actually being at the top of the most important weaknesses. Both Piero and Camila has mentioned the importance of informality, but you know what? Using data with an index from the World Bank, firms informality among Latin American countries, Peru is the number 3, only Mexico and Bolivia are worst in terms of firms informality in Latin America. So then also in terms of savings ratios and financial intermediation, inclusion, and the capacity for the government to actually implement transfers, were absolutely really bad and are really bad in relative to other Latin American countries. And most importantly, and also Camila and Piero has said, low government efficiency and low implementation capacity has been a problem in Peru that has been underlined by many people for a very long time. So yes, there has been a lot of mistakes, but initial conditions do matter, and Latin America, at least in terms of death, is not that different. And this is an important point to underline. The second point is that there is kind of a paradox, right? And I call it the Peruvian paradox, is that how come, in spite of very deteriorated economic prospects, as Piero said, the forecast for growth range, there's a range, right? From about 12% to 16% so far. I mean, that is going to be changing, and which is indeed the worst in Latin America. But how come, in spite of that, the country enjoys good access to international capital markets with actually very low cost of financing? Actually, the MB spread, that's of course for secondary debt, but it's still of sovereign bonds, is among the lowest among emerging markets, certainly the lowest in Latin America. So how come international investors are rewarding a country with such deep economic contraction? Well, there are two answers to that, right? The first is that there has been, as we all know, a huge expansion of liquidity by advanced economies, especially the United States. And there is now a new wave of search for yield among international investors. And for the time being, inflows are going to a broad range of emerging markets. So that is from the general point of view. But second is that at the onset of the crisis, the macroeconomic indicators were actually very strong, not only among Latin America, but among the rest of the developing world. Had a very high position. I have an index that ranks countries, and Peru was at the top with Chile, as Piero mentioned, but among emerging markets. Peru started with a very significant fiscal space, very low inflation, large accumulation of reserve, and most importantly, no debt sustainability problem. So expectations are then that if the fiscal expansion is large, and well, it's forecasted to be large, although we don't know yet how much of the announced expansion is actually to be materialized, Peru will be able, and if the mistakes that Piero mentioned are going to be corrected, then Peru will be able to repay its debt in a timely manner. So the international community is not concerned about the capacity of Peru to repay debt. Now, one could say, okay, that's fine, but this is not the minor point. This is a very important point. So there is a hope in the international community that, in contrast to many of the other countries, Peru will be able to find much needed resources of finance that can help restore the path to growth. Finally, to go back to your question, this is actually being reinforced by the IMF extending the flexible credit line to Peru, which is granted to very few countries in the world. Right now, it's only 4 countries in the world that have this flexible credit line. And that at this moment, the interesting part is that in spite of all the mistakes of mismanagement, in spite of all that, there is a strong hope for Peru and a solid foundation because Peru can access resources. You ask, I mean, most countries, and you've been interviewing countries that are basically starving for resources. And in the region, we have Ecuador, we have Argentina, I mean, no resources whatsoever, right? The same amount of debts, but no resources. Peru does have a strong position, and therefore there is time for correct mistakes, remembering that it started from a very strong macro, but a very weak structure. Let me stop there.
A perfect summary. And I think, it's always, I worked on health system issues for many years, and it was always so shocking to see the difference between the world-class macro and then a health system that just never invested very much and that did not perform as well as you would hope, given the levels of economic growth and the wealth of the country. So maybe I'll, and we see that. I mean, we're having shortages of oxygen. I don't know what measures are being taken to pre-purchase a vaccine. Should a vaccine hit the market soon? It seems like that would be an important priority for the government as well. But can we correct, as Liliana says? So money is no constraint here. There's plenty of financing. So let me go back to you, Camila. What is it that we should look for in terms of health investments for the rest of 2020? What do we hope to see government doing and spending on for the rest of the year? Should they be asking for more? Are they not getting what they need? Or is it simply a capacity issue? And then what?
I think, yeah, I mean, there is the possibility to get loans, but loans for what? I think that's the big question. And I say that thing that Piero already says that I mean, we share a concern about the capacity and the willingness of the state. Where are the priorities for the state? Where they want to start? I mean, there is no clarity on that, and I think they are not really showing any clarity on where to start. And for sure, there are claims saying, yeah, we need a universal bonus for all the people and to restart with a strict lockdown. We need to think about that. I mean, this is something that is even possible. Already we saw that that is not working, and we are in the situation that, I mean, we are in the situation that already a lot of people have lost their job. And so if there is any kind of bonus that can reach these people, because we also know that there is no capacity. I mean, the state don't know where are the citizens. So probably it's better to try to start or to try to think on how to help small business or some type of activities that allow people to at least to stay in the localities, and to try to think of more targeted lockdowns, and in that localities we provide a lot of assistance to the whole population, and for that the state can think on asking for some resources, extra resources for that. But first we need to know where the state wants to start, and with this political crisis is difficult. I mean, we don't have an executive that is calm and to try to say, okay, this is the plan. Is really difficult. And it's not only the Minister of Health, and it's not that say, yeah, the economy, no, the health, yeah. I mean, both things can go together, and I don't think that it has to be this polarization. I mean, that have no sense. But we need to see a plan, and until now we have not been seeing a plan. And in the middle of this crisis, when we saw that yesterday was the day with the highest number of deaths, reported deaths, after 5 months, which reached 221 people dying for COVID. And so I think we need to have a plan, and there's little signs from the government that they have a plan for that. So the access to loans and the potential is good. There are good news on that, but who is going to implement that? That is something that we need to.
Let me ask you, Pedro, about the business community's role in all of this. You would expect that, given what we're seeing, that there would be some unity among business leaders with respect to the political parties and things like that. Are you seeing any moves coming out of the private sector that could help with the development and adoption of a plan to correct the mistakes, as Liliana put it?
I think limited, to be honest, limited. But let me say something that to complement what Camila was saying, that I think is very important. I mean, we saved a lot. We built a war chest. This was the year to use it. So it's great to have access to international finance, but if we have the worst contraction in Latin America, right, when we were not worse than Ecuador or Argentina, something is wrong, because we exactly had that capability to do countercyclical policies this year. So I think that we need to be very concerned that precisely this year, when we were supposed to shine, we did not, okay? So it takes me to the next point. I think we had a tremendous scarcity of ideas, more than money. So I think money is not a problem. The problem is a lack of ideas and strategies and capability to implement. So, and that goes in many different situations. You mentioned the private sector. Let me give you an example. The mining sector generates a lot of resources for the economy. But because the population in general does not benefit in terms of good public services, right? And in general, they feel that the mining is not doing any good to them. When it's obvious that mining is doing a lot of good things for Peru, but because it generates fiscal resources, taxes, dollars, etc., but because the money is not well spent, people don't feel any benefit, right? So I think I'm not worried about debt sustainability in Peru, and Liliana and I worked with that like in the past, and we were probably the first ones we said in '99 that Peru may get investment grade, you know. But so I'm not worried too much in the short term. I think maybe in the medium term, there are issues to be concerned about Peru. My main concern is the lack of strategies and ideas, and it goes throughout the political spectrum. I think that the private sector is doubling up on the same things that no longer work. I think we need to be more strategic. We need to address the issue of dualism, right? Because informality is the other side of a coin of dualism. We have a dual economy with first, world companies like that are like our mining companies, our agro export companies are world class, top of the line, the most competitive sectors in the world that live, right, cohabit with a large number of very low productivity company, small enterprises. And we need to address that. It doesn't get solved automatically. So you need to do something, and government capabilities need to be built there. And you're not going to outsource it with government to government solutions. You need to do it. The only way to learn is to do it. Nobody learned to drive being a co-pilot. You need to do it. The government has to do things. And I'm not particularly optimistic in seeing ideas, strategies, or stuff that looks promising. Not in the current government, not in the main candidate for next year. So we need to stress that. That's an issue to worry about.
Can I ask you, Liliana, you respond to all of this, but also what do you see? So we said it's really not about the financing, but what about ideas and planning support from the international community? What can they provide? Obviously, the advice was not great to the country on the serological antibody testing strategy that was used initially, just as an example of one way that the international community sort of didn't get its act together to give clear recommendations. But can you reflect on that issue?
Yes, let's talk about ideas. First of all, we know that in terms of the firms, the small and micro enterprises are the ones that have not been able to get as much support as needed from the existing programs. This is not unique to Peru. Actually, the programs of transfers has not been through government guarantees, when the guarantee actually provide the support, a loan given by a banking system or the financial sector to a small enterprise or a micro enterprise with the guarantee of a government. Actually, they have not been working very well around the world. In my view, and actually now in the many economies by now, is that if you want to protect micro and very small enterprises, well, grants and not loans is the solution. You have to recognize that after the pandemic, there are a lot of things that are going to be changing on a permanent basis. That many of these small firms are actually going to be out of business. So you have to focus then, especially on the micro enterprise, the distinction between the person or the household and the enterprise is almost the same thing. So you really need to basically recognize in the fiscal, in the budget, that those guarantees, actually, you can count it as they materialize, and therefore they should be a transfer directly. That's number one. Number two, something very important in the productive capacity of an economy is the network connections that firms have developed over the years. Their connections with their clients, the suppliers, and most importantly, their trained workers. So this capital for the firms and the losses from that can happen from this connection would result in large decrease in productivity for firms and the economy. So protecting that network, that connection is extremely important to actually support the recovery in Peru. Third, recognize that bankruptcies are going to take place as the economy is opening up. A lot of bankruptcies are going to materialize, but because the economy can open, but the demand is not there because of the not only of the current losses of jobs, but also because of the huge uncertainty. So in that case, and I think that's what is going to happen, it's important to have a plan ready to assess which are the viable firms and which are not. Because you really have now a problem of who are you going to maintain in the economy, right? Are you supposed to support all the firms? No, you're supposed to support individuals. You're supposed to support people, but not necessarily firms. Some are going to be viable and some are not going to be. So you need to have a program to distinguish between those who are viable and which are not. Now, the ones that are viable are going to need capital injections. In many cases, they will not be able to survive without those capital injections. How you can do that? Well, this is very difficult. So one proposal, and actually we're going to have, the reason why I'm talking about this is because we have a working group that has been working on these issues that will come from CGD actually very soon. There is a role for multilateral organizations here. For example, the IFC and the IDB Invest could actually provide very useful support to help countries in the, and Peru in particular, to determine which one of those firms are viable to provide capital. And very important, in a country like Peru, if you offer capital from the government, an injection of capital to a firm, you know, with the story that Peru has of nationalizations, what country wants to receive capital injection from the government? That sounds like, oh my God, the government is taking over, even if you need it. So that's why the role of a third party that could actually channel in the funds could actually work against the stigma of receiving capital injections from the government. Let me stop there.
Okay, yeah, so more soon from Liliana and the working group at the IDB. But I want to go back to you, Camila. We have one question from the audience, which is around citizen engagement and civil society organizations. How have they been involved in defining or informing the government strategy? And or the media? I mean, obviously the media has played an important role in diving to some of the discrepancies in death reports and others. But what would you say works there? What would you propose in terms of a different modus operandi for the government? Should the international community support some of these civil society organizations, universities, think tanks a bit differently when thinking about the response? Go ahead.
Okay, I mean, civil society is broad. So, and I think the response is also showing the type of relation that the state, the Peruvian state, has with civil society. I think the one major mistake that the state did was to not listen to civil society in the case, for example, of the indigenous population in the Amazon area. Because since the beginning, they were trying to propose solutions and ways to try to stop the spread of the disease in the territory, and the state was just not listening and insisting not listening to them. And now there is a confrontation, and that could be prevented like early in March. So I think and that shows that the state has not been really open to listen to civil society from the different level, even from the private sector, big enterprises, and that. So there has been these tensions all the time saying, yeah, the state is not open to listen and that. And I think that has been a mistake. And I think that we have some possibilities, the Acuerdo Nacional, that there can be spaces to build some consensus on that with the plurality, and that is a space that probably we can try to get more and more presence in the debate as a space to get some consensus. But I think that what we need to do now is like to try to think, and I want to stand on that, is how we are assessing the Peru and in general the region development and growth and health system, and to stop having this public health system with minimum packages for poor people without any access to complex care, because we are paying really high for that. So health system cannot be minimum packages and to push people to buy from the private sector, because this is showing that this is just not working like that. And we have to see that we need to invest more on health, and to invest more on the strength of the health system, and on the capacity to refer from the health system. And I think the civil society can provide some ideas on that. And but we need to have also a state that is willing to listen. And I think that is not the situation now from the different sectors, not only from indigenous organizations and that, from the different sectors.
So, Piero, you're involved with a think tank. Tell us a little bit about your thoughts on sort of the role of these civil society organizations like ourselves in looking at the response and making recommendations for the future. You talked about it, ideas. You had a deal restart. How do you see external to government becoming more influential?
Yeah, let me say one thing about what Liliana said that I think is very interesting. One group of companies that may welcome capitalization are the microfinance institutions, because the quality of their loan book has deteriorated. They're most likely, and they actually talk to them, they will be very happy to get some temporary government capitalization, right? You strengthen the capital ratios. As a result, they will be more happier to lend. And I mean, that's a jewel that Peru has, actually. The microfinance sector in Peru plays a huge role in lending to small enterprises, and it's unique compared to other countries. And given that we don't have any public institution that lends, it plays the role of a public institution. No? So I think like that. Second, our key concern as an NGO is that we're talking about this global development, that we really need to work about dualism. And what do you and how do you deal with that? You need to insert some of these small enterprises in dynamic value chains. So, I mean, like the informal sector, right, per se, doesn't have a future if it's not part of something that gets productivity and growth and gets inserted into the dynamic value chains. Our sense is that the problem is that these small institutions do not reach the quality levels needed to be able to be a reliable supplier of a larger company. So there is a role for both articulators in the private and the public sector to strengthen those chains and make sure that we don't have just small enterprises that are just residual, subsistence enterprises that just exist because there are no jobs in the formal economy. We need to make sure that, and some of the work by Banerjee and Duflo, for example, show that easily 2/3 of these small companies have a potential to grow and insert themselves into more dynamic forms of work. And something that we have not emphasized enough is that this has been a massive failure of the Peruvian society. The public sector failed, the private sector failed, right? So we need to solve it together. We cannot just pretend that only the government is going to solve it, only the market is going to solve it. We need to work together. And that's where you need, as Camila said, you need a conversation that includes many actors in the in the room, right, in the table, and start to see what your problems are and what the solutions are. And then you ask for the money. The problem sometimes in Peru is the other way around. You have the money and everybody runs to get the money, but there are no ideas. First, see, okay, I want to insert the producer, it's something I'm doing actually, the producers of avocados in Moquegua, right? They need to be inserted into the dynamic chain, agro-exports chain, and right now they are not working. What's the problem? Irrigation, right? What's the problem? Technical assistance. What's the problem? Financing. Okay, how do you need to do, what do you need to do to us, to help them start to export through an intermediary, right? And then you need to get the technology, you need to get the finance, and the different actors in the room. But I think we have to solve this problem together through a dialogue, but also working together, learning to solve problems. And the issue is not just talking, but just doing. And that's, I want to emphasize, we are not going to solve state capabilities and strengthen state capabilities just talking about a huge state reform, a government reform. We will need to do it little by little, doing stuff. And the saddest part of this crisis is that the Ministry of Health did not use the opportunity to build some capabilities in testing and tracing, as we said at the beginning, right? I mean, it has been like, we are with the same capabilities as in March at that level, and that has been sad. That's it.
Returning to that point, we have another question around sort of the health system response. That the comment is the government response was too hospital-centered. Primary care was closed by the government for 3 months. There was little community-based approaches to prevent case complication through early detection and isolation. So can you comment on how the pandemic is likely generating more deaths among historically excluded populations or those with less access to hospitals, et cetera? Generally people who did not have access prior to this crisis and they continued not to. I would also say, you know, it's remarkable too, hospital-based mortality was also quite high. So even if it was a hospital-centric, they didn't seem totally prepared to deal with it. Do you have any insights on Camila?
Yeah, okay. It's not the primary health facilities were closed. I mean, what was closed was all the outpatient services. So all the health system has been just working on COVID. Yeah? The problem is that that also have a cost. And I would say, I mean, you cannot have a health system just working on COVID for 5 months. So you need to have some plan to open and to provide some care to the other things like vaccination campaigns and that kind of things that we need to do at the primary health facilities. The problem is that the government started with the cash transfers and that with a strategy that think on a urban situation like Lima, big city situation. So you give the guidance to say, okay, stay at home. Don't when you have minor signs, just stay at home and then come to the health facility, without taking into consideration that in the case of rural areas, you cannot afford that because then it's going to be too late in any case. Yeah. The other thing is that you have it was not that there were no problems before. We already have problems, and we already have, for example, in the case of the Amazon, an ongoing dengue outbreak. So the health system was already in stress, and there were no clear guidelines to say even to differentiate dengue from COVID. You know, they have some signs that are quite like they share some symptoms. So the response has been just focused on EMAs as always, and without thinking in the different realities. And now you have a situation that the health workers at the primary health level, they has been working on COVID, they're exhausted. Many of them have get sick. And this idea that the community health workers, I mean, we didn't have that before. Outreaching activities was good like years ago, and we has been saying we need that, and that wasn't in place. if you saw the images of the epidemiological team, the CDC in Lima at the beginning of the pandemic, with 15 people, that was, okay, with that, we are not going to make it. And so we are paying that. So we were not prepared at the primary health level. We need to think how we are going to improve that now that we know the cost of this have. But yeah.
Great, Camila. So, primary health care and public health capacity, as you said, in the Public Health Institute, just not much capacity to speak of any kind of surveillance or a technical assistance, accompaniment to subnational areas and things like that. Let's see, Liliana, do you want to reflect a little bit on the role of the international organizations in assisting or not at this stage? Like, would you like to see? And then I'll ask each of you to say 2 minutes and comments. So maybe this is your last comment, Liliana. Go ahead, tell us, wrap it up for us. What should we take home?
Okay, first of all is after this conversation, it's difficult to be extremely optimistic about what's going to happen in the near term or medium term future in Peru, especially because of the huge impasse between Congress and the government. And that is going to be more complicated because next year is an election year. With an election year, uncertainty increases. We have no idea who the final candidates are going to be. And so taking action and actually, even putting together forward ideas for change might not there be even enough time for implementing and not political will to compromise between Congress and the government to actually, implement whatever great ideas we could put forward. And finally, another reflection that relates to what Pierre was saying about small enterprises and the future of Peru. Certainly, Peru is one of the countries that have been trapped for a very, very long time with this commodity dependence for economic growth. So Peru has been going down in economic growth for several years now, actually since 2014. The decline in economic growth was the COVID-19 did not start the decline in economic growth. It exacerbated it significantly, but Peru was on a declining growth trend, precisely because of this high commodity dependence. The restructuring of the economic productive fiber of Peru definitely is the long-term expectations for the future, and that needs a lot of little and slow work, as Pierre was suggesting.
Okay, Camila, 1 minute final reflections before we end.
No, I just try to explain that we need to think the money for what and where we are investing and how we are assessing development and health system performance. Because I think this is a painful learning lesson, but we need to learn from this and to build something better. Yes.
Ojalá. Okay, Piero, final comments.
I think Peru used to be, we had this idea of Peru that on the one hand had a great macroeconomic indicators and very weak microeconomic indicators, no? The micro kind of won, our weaknesses have kind of won. And now the hard part, unless there is a huge commodity boom, it's very difficult to be optimistic about the short-term and medium-term growth and economic development prospects for the country. So we will need to really make efforts to build. For me, the first thing is trying to build state capabilities, both at the national level, at the subnational level. There are some ideas we have been suggesting in Hacer Peru. And I think it's without that, we're going nowhere. There's no country in the world that has been able to develop with such a weak level of state institutions. And the over-optimism that many people had in the past, I think proves to be just misplaced. It's obvious that Peru was never in the path of development with this level of state capabilities, and COVID-19 just made evident what was in a way already evident. Thank you.
Okay, so we didn't end up very optimistically, but on the other hand, it's clear what needs to be done. So thank both all of you for sharing your perspectives. And I hope that we can talk again, maybe in a couple of months, to see where things stand. As you said, the election next year makes things very complicated in terms of the incentives that politicians face, but we hope that they come together to deal with the most immediate problems. So thanks to all, thanks to the audience for watching. Take care, and until next time.
Bye, thank you.